So the complement system is an ancient and evolutionarily conserved system that has been established to complement other arms of the immune system and work in concert with them. The proteins of the complement system are primarily synthesized in the liver and secreted into the blood, where they largely circulate without having any activity. But in the presence of an activator, which in general is a pathogen, these proteins become activated and the complement cascade ensues. What's interesting about the complement cascade is no matter which arm gets activated initially, all of the arms converge into a final pathway, which is called the terminal complement cascade. And part of what happens in that pathway is that the final proteins there co-assemble to form a multi-subunit protein with a central core. And that complex gets inserted into membranes, literally poking holes in the membranes and killing the pathogen. Now, when that happens and the MAC complex is inserted into a bacterium, that's a wonderful thing. But often what happens is the complement system is dysregulated and the MAC is deposited into normal tissue. And when that happens, the same thing happens to that tissue as would happen to a bacterium. The tissue becomes inflamed and is subject to dying. So for example, in an autoimmune disorder that is called myasthenia gravis, there are antibodies that bind to the acetylcholine receptor at the neuromuscular junction. And when these autoantibodies bind, they activate complement. They bring complement in, this complex is assembled, and it literally pokes holes in the neuromuscular junction and destroys the architecture. And not surprisingly, these patients then present with muscle fatigue and muscle weakness and difficulty engaging in everyday activities. Alexion realized very early in its existence that targeting various elements of the complement cascade could result in turning down that complement activation in diseases like myasthenia gravis or neuromyelitis optica spectrum disorder, where the system is dysregulated. And Alexion really pioneered in this area and launched the first complement inhibitor with the approval of Soliris for paroxysmal nocturnal hemoglobinuria. And since then, Alexion has really been thinking about what patients need who have complement-mediated diseases and making sure that subsequent assets in our pipeline are developed with this patient need in mind. So for example, our second generation complement inhibitor, Soliris, is a drug that is infused intravenously, but only every 8 weeks. And that's a big improvement over what patients experienced with the first generation Soliris that had to be infused every 8 weeks. And we're now actually developing our third generation complement protein 5 inhibitor called Alexion 1720.